Hello, and thanks for joining us for Staffing Unplugged, a medical solutions podcast that delves into the world of staffing and recruitment. Each episode, we bring you insightful discussions, expert interviews, and thought provoking conversations with industry experts. I'm Kristen Dahl, your host, joined today by Robert Crowe, Executive Vice President of Diem and Local Workforce Strategies at Medical Solutions. Thanks for joining me today, Rob.
Yeah, thanks for having me, Kristen. Excited to be here.
Can you start off by telling us about your role at Medical Solutions and a bit about your journey into the healthcare staffing industry?
Yeah, sure, I'd be happy to. So I came to Medical Solutions through the acquisition of Matchwell, which is a company I founded back in 2017. As such, my role at Medical Solutions is to find ways, leveraging the Matchwell technology or others that help healthcare organizations access and engage a flexible workforce in new and more direct ways. We're really focused currently on hiring that local, call it gig or kind of shift workforce.
And you had mentioned you're also the founder of Matchwell, which is a tech enabled job marketplace, which is a part of the Medical Solutions family of brands. Can you tell us more about Matchwell and how it's transforming the healthcare staffing landscape?
Yeah, absolutely. So after working for 2 decades in the staffing industry, I started Matchwell as a way for healthcare organizations to post jobs and directly access that flexible workforce I mentioned previously. And part of that is when the fastest growing segment of the workforce are people maybe not seeking full time jobs. We wanted to help organizations quickly post those jobs, track pipelines of candidates, and make it easy to actually access that growing flexible workforce. Again, without going to a bunch of job boards or maybe the traditional agency approach. What we did first was build technology to help healthcare systems organize their existing workforce. So, kind of organize that workforce into float pools that could then be deployed like Uber or some other, really quick button to cover those open shifts. This simply helps healthcare organizations optimize the existing workforce that they already have before having to go out and find new resources. We then built a hiring marketplace where healthcare systems can, again, quickly post those jobs out to that marketplace to find new people that could join their organization. And then finally, what we did was we added a W 2 employer of record. So if that healthcare system did not want to hire and onboard that new resource into their existing internal payroll, we could be that employer of record for them. We could provide all that service. So they get all the benefits and the protections of a W 2 relationship with maybe a traditional staffing agency, et cetera, but without maybe some of the cost of doing that. So, in other words, it's technology and support that helps healthcare organizations expand their own existing workforce to be more flexible, and then also kind of this do it yourself hiring platform.
Perfect. That's all really exciting and kind of seems like new and innovative ideas coming into the staffing industry. So, Rob, I know you've been in the industry for quite a while. You mentioned maybe over 2 decades. So, I know you've probably seen a lot of change. I'm curious, how do you feel about the industry overall? And what are you seeing in terms of workforce trends?
Yeah, so I have admittedly become somewhat of a workforce junkie over the years. Over now 25 years in the industry. So, and I love being part of an industry that evolves as people's working relationship with work evolves. Throughout all of society. And so, 25 years ago, we were transitioning from paper and fax machines into basic applicant tracking systems and leveraging email. I remember when our office got one shared email account, for all of us. Then what we did was we saw this the rise of managed services and vendor management technology to kind of communicate your jobs out to a lot of different agencies at once and manage that traffic. I did have the opportunity to build two early vendor management systems as that trend was coming out. The latest employment trend is really about work life harmony. People in all industries and all jobs are seeking more flexibility. Call it the gig economy. I've heard it called freelance nation. But the reality is, this flexibility is becoming the new normal with a lot of employment out there. And healthcare is no different. And so, especially with the pandemic, I think that fast forwarded some of this trend that put this workforce into overdrive. And so now we're leveraging technology like the Matchwell platform and others to help organizations actually better tap into that flexible workforce.
For anyone who has heard you speak before, they've probably heard you talk about how flexibility is the new currency. That really sticks out whenever I've heard you talk in the past. And it also goes hand in hand with what Matchwell is trying to achieve. Can you expand on the importance of flexibility in the current work climate and also explain some of the key benefits of flexible staffing for both healthcare facilities and for clinicians?
So I do believe that flexibility is becoming table stakes in order to attract talent, but then also to retain those people in this modern work era. In some industries, when people can work from home, they're getting a little bit more of that flexibility, work-life harmony into their lives. And that's a little easier to achieve. But when you're a clinical workforce and you're seeking that work-life harmony, you still have to be on site treating patients. And so, how do we actually provide some of that flexibility for them? So, in some ways, we're talking about alternative shifts. So instead of the traditional 12-hour shift, maybe it's a 4-hour shift or an 8-hour shift, or maybe it's weekends only, or maybe it's joining a float pool where you're kind of moving around. One of the trends we're seeing right now are healthcare organizations setting up, quote, internal agencies so they can kind of embrace flexibility for maybe they're putting somebody on quote a contract for 3 months or 6 months, even within their own organization. For one, a nimble workforce helps balance that maybe patient census that is fluctuating, so up and down there. But I'm really interested in helping that workforce achieve that flexibility to help prevent burnout. How do we retain this workforce? How do we keep them from leaving us in the first place? And so back to the table stakes, if you're a healthcare system and you're not offering some degree or a program of flexibility, but there's another healthcare system that is, you're vulnerable to lose your workforce over to that other organization. So by investing into these flex work programs internally, healthcare systems, again, can better attract a new group of employees and maybe keep the ones that they have a little longer.
Implementing flexible staffing sounds great in theory, but just like with everything, I'm sure there are some challenges that come with it. Can you also explain some of the challenges healthcare facilities might face when it comes to flexible staffing and how they can overcome some of those challenges?
Yeah, for sure, 100%. So change is hard. It can be fearful. Everybody talks about innovation, but then they usually just keep doing the same thing. And so, for an example, some organizations are fearful that if they actually do offer flexibility to their employees, maybe all of their employees, their entire workforce will want that. And that's kind of overwhelming to think about. The reality is, yes, people want more flexibility in their life, but they don't want a paycheck that's flexible. They do want that full time continuity of pay. Their mortgage is not flexible, inflation is real, college is expensive, etc. So, this is really the danger is less that you'll get less hours out of your workforce. It's really about offering more flexibility just in terms of when they provide that care. And also, again, back to what we were talking about earlier, open up new ways for more people to work for you. So it is a tool for both attracting and retaining when you embrace that flexibility. Speaking of innovation, we did just kick off, and you've probably seen some of this out there in the industry, the nation's first statewide resource pool. And this is in collaboration with the Indiana Hospital Association. So imagine having one database where all these clinicians across the state are organized, and then hospital systems, healthcare systems across the state can post jobs and access those people with no middleman involved. So that's new. It's also members across, hospital members of the association across the state kind of recognizing that they share a common challenge. And by working together across a statewide level, they can actually maybe be a little further along in implementing change. And so, again, when you're operating in your own silo and you want to do something different, that's a little harder than if there's lots of organizations maybe taking that step together. The other piece of that is the more people collaborate and the more we can get this people working together, that adoption will just lead to better outcomes. And so again, kind of lifts the tide for everyone. And the exciting thing is other states have looked at what Indiana's doing, and now we have multiple other states wanting to follow that trend.
Yeah, that is exciting. Again, just those innovative solutions. It's great to see those gears kind of changing and finding new ways to help solve some of these problems that have been out there for a while. So, I did want to ask you, I know you've kind of mentioned this a little bit already, but given the current nursing shortage, can you also expand on how adopting a flexible workforce model could not only help healthcare organizations retain their existing staff, but also attract new clinicians who are looking for more of that work life balance?
Yeah, so as of this past March, staffing industry analysts, and I think it was a McKinsey study, if I'm getting that right, but they reported roughly 36% of the US workforce, which is roughly 60 million people that are in the workforce, are currently participating in that quote gig economy. They also are saying that roughly 20% of the entire workforce now work exclusively within that gig economy, meaning they don't have a full time job. They're piecing things together. That's a significant number. And so when we see this rapid growing segment of the workforce not looking for that traditional full time job and really embracing flexibility, we have to offer flexibility and create roles that these people want. So I think that's kind of step number one. Shift in contract work is a way to offer that flexibility. And so if you're offering those kind of programs, you're better positioned to fill in gaps or kind of float people around more nimbly within your organization. And then those organizations can maximize the use of this workforce while keeping costs down. If they only go to the more expensive options to access these people, it may not make sense. But if you can keep costs down and actually start optimizing that workforce, it can work to your advantage. So maybe more directly to answer your question, I do believe that every healthcare system in the country should have a robust internal flex work program, almost like that internal Uber pool of clinicians we talked about earlier. That lets employees have more flexibility on when and where they pick up shifts, and in doing so, you just get access to more people to join your workforce and take care of your patients.
Absolutely, that makes perfect sense. Now, I'd like to shift our focus over to float pools, which are often mentioned as a solution to staffing challenges. Can you explain what a float pool is and how it functions within a healthcare facility?
Yeah, so these flow pools are those resources that they may work full time schedules, but they just don't work in the same unit all the time. So maybe they're moving around based again on census or based on just need. Somebody called out sick, etc. So in some cases, this employee may float and work 1 or 2 days a week instead of full time, or maybe it's 1 or 2 days a month. So it's a program that allows an organization to kind of have a large pool of resources that move around based on the business needs, based on those gaps. So it's very dynamic in that way. Of course, managing such a program via spreadsheets or cell phones has some limitations. And so, we've got massive healthcare systems across the country that sometimes have a very small resource pool because they don't yet have that technology. They don't yet have that infrastructure to really expand it. And that's where technology comes into play and leaning into what's available to us in this era to really be able to manage large groups of people with the press of a single button.
What role does technology play in managing float pools, and how does Matchwell specifically support that?
Yeah, so Matchwell is an enterprise technology platform that can be white labeled. It can sit on different domains. So this can sit on a healthcare system's internal website and be really powering their internal workforce, so that float pool program. It also then, as mentioned earlier, has this hiring marketplace integrated. So when they have gaps and they just need to hire more people, they can release those jobs out there and attract qualified clinicians that are pre-vetted in seeking new opportunities. So it kind of has all the functions, tracking who is working where. It has the time cards, the evaluations, and so much more, just to simply organize that workforce and maximize its productivity. Again, this is really about healthcare systems managing their internal workforce programs and giving them the end-to-end solution to really grow a really robust program.
And Rob, with AI being the big topic across all industries right now, can you also talk more about the overall role of technology and how AI will help healthcare staffing in the coming years?
Yeah, so AI is speeding up how quickly we can identify scheduling gaps and see available resources even before that job is created. It's creating draft communications for reaching out to people. It's helping read resumes and hiring, speeding up that hiring process. It's helping us make better business decisions based on data. But we are still in the early days of unlocking and linking data between systems, which can allow these tools to really flourish. I do believe that that is coming very, very quickly, and so we're dabbling with it. Everybody's kind of dabbling with it to kind of see how can we maximize the use of this. So imagine when a recruiter can focus his or her entire day just building relationships with people, just talking about what drives them, what they're looking for in their career, what their career path is looking like, instead of worrying about data entry and instead of trying to connect all the dots in these different technologies. Or imagine when a scheduler is simply reviewing a pre-populated schedule and confirming it versus trying to put all the puzzle pieces together and figure out where people go. AI are the types of tools that can make those lives, those positions very effective. Even going so far as imagine having reports that take data from multiple systems and actually bring to you the next best action that you should take instead of you trying to take all this data and figuring out what to do with it. So it's an exciting time as technology is rapidly evolving. And a lot of this is just going to make these types of flex work programs or even just hiring in general, hopefully a lot easier.
Absolutely. Well, we've covered a lot of valuable information today, but before we wrap up, I always like to ask, what is one key message or piece of advice you would like our listeners to take away after listening to our show today?
Yeah, wow. I think we've covered a lot. In closing, I simply want to stress to our listeners that embracing flexibility does not have to be scary. And I think, on the contrary, if you've got the right technology, if you've got the right partners, it can be quite innovating and energizing to open up the doors for a lot more people to work for you.
All right, perfect. Great advice. Thank you for joining me today, Rob.
Yeah, thanks, Kristen. It's fun.
Absolutely. And thank you to our listeners. Please join us every month as we unravel the complexities of healthcare staffing and recruitment, sharing expert insights and actionable advice that can help you with your recruitment efforts. In the meantime, visit our website, medicalsolutions.com, for more information about our healthcare talent ecosystem and how we can help your facility reach its full potential. Thanks again, and we'll see you next time.